we're all busy, whether you're like your community, you're pre-med, you're in medical school. And also, and also just to be able to be part of a community that you're interested in that is aligned with what, your goals are in life. Like our tagline is date like-minded professionals. And this is, a niche dating app is absolutely not certainly for everyone, but I think this is such a huge need, to have this dating app because there's this gap in the dating app world currently, and that I wanted to be able to, fill that gap for our community.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. This is Erkeda, and I'm here with a very exciting episode. We have Dr. Chrystene Nguyen here to talk about some really innovative things that some people who are listening may be interested in. But first, I'm going to let you introduce yourself and tell us about your journey to medicine.
Oh, thank you so much, Dr. Erkeda. I'm so excited to be here. I'm honored to be on your podcast. Love all the work that you're doing. So I'm Dr. Chrystene Nguyen. I'm a board certified physician in both family and lifestyle medicine, located in Southern California.
That is awesome. So we know that you practice medicine, and a lot of times we'll hear about people's journeys and how they got here. And I think we're going to do something different today. We're going to chat about the other endeavors that you're in taking. You created an app called White Coat Romance. Can you tell us about that?
Yeah. Oh my gosh. This is never my wildest dream that I ever thought I would embark on this endeavor, but it's just been really fun and exciting. And yeah, I'm excited to see where this will take us. So, really how this all started, it was really born out of a need and a frustration. So I'm single. I work in urgent care. And during the COVID quarantine, certainly everyone's world was turned upside down and, physical distancing in place. And after a while, when things started opening up more and some of us started to spend time with one another. And for me, the only people who felt comfortable hanging out with me, especially with my work in urgent care, because, I joke about having the COVID cooties, were my friends who were, in the same space, who were also healthcare professionals. So we started hanging out. I knew that I wasn't alone, and not just myself and my friends, but there was this much larger community out there. And also there were all these communities that were popping up, in Facebook, physicians, and other high-level professional groups. And so I started the Facebook group called White Coat Romance. That's how it started in July of 2020. And that is a much smaller space. It's more just a few high-level professionals like physicians and dentists and pharmacists, optometrists. And it was just a really wonderful space where we could come together. We virtually mingle, provide support, funny memes. We have live events, and lots of friendships have come out of it. We've also had a lot of in-person events, also virtual mingle events as well. And then from there, I recognized that there was a need for a much larger community that had also reached out to me and expressed interest in being part of this community. Because certainly, as we all know, dating in itself is really tough, but dating as a physician and other high-level professionals is really, really tough. And there's just so many things to consider and a lot of barriers that we may have to, think about. So we have special needs and we have unique demands and challenges that no other profession has. And so that's why I decided, that I wanted to also make a bigger impact. And I developed the dating app with the help of a developer, which launched last month. And this is for a much larger audience of healthcare, whether you have a doctorate degrees or a master's degrees. You can also be a PhD, with the white coat theme. You can be a bench scientist, virologist. You can also be an engineer, but certainly biomedical or chemical engineering can also, of course, your audience, medical students, dental students. And so I'm really, really excited. And I'm just really delighted that you have me here on to talk about it. And we really should talk about this aspect, of our lives, right? Because certainly, I truly believe that a really big part of optimal health is having the community and the social connections and the positive relationships that is often overlooked.
I couldn't agree more. And you hit on so many wonderful points. Number one, dating is interesting anyway. Like during these times, it's nothing like when we were younger, and not like to age ourselves or anything like that. But we're in a digital age and dating has gone digital. And to be in healthcare, especially during a pandemic, it definitely showcased the isolation that some physicians may have because we are dedicating our lives to serve patients. But sometimes the lay people, of course, we don't want to put them at risk, but it's just a different time. So not only are there the layers of being professionals, on top of that being healthcare professionals, but having to find someone that has similar interests, understand your schedule, and all of those things is important. And yes, there are a lot of dating apps out there, probably one for every flavor. We won't name them, but White Coat Romance is here to kind of bridge that gap and allow you to get outside of your circle so that you can figure out how to connect with those individuals that you may be interested in spending time with.
Yeah, absolutely. Thank you for touching on all those very, very important points. So the reality is, like, I would say I don't love dating apps. Most of my friends don't love dating apps, but it's here to stay. We are in the digital world that, encompasses all aspects of our life, including our social, relationship, dating lives. And so that's the reality, right? And so, like I said earlier, like it came out of this frustration. I said, like, I want to design a dating app that I want to use and that my friends want to use and that our community also wants to use as well. And that it captures all those unique needs that we have. And so that's why, it's been very, very important for me to get feedback from our community in terms of what is it? What are your pain points? And let me, let's kind of ease those pain points and let's make this work, right? Because dating apps can be a very incredibly powerful tool to expand our dating network. And if I can bring a community together that perhaps that we may be interested in dating, that, like you said earlier, with similar intellectual, financial, life goals, core values, then let's filter some of that out, some of the noise. Because like literally you can make being on a dating app like a part-time or full-time job if you wanted to, right? There's just the constant like swiping left and right. And there's also other factors, right? There's the safety issues as well. Encountering your patients is also another big issue, right? So these are all things that we've encountered in the past, if you've ever been on a dating app.
Absolutely. Like it is definitely interesting times. And like you said, like there are safety issues. There are the other issues. I know a lot of people, specifically women, who are professionals in healthcare are concerned, physicians talking about like, should they disclose like their status of being a physician and things like that? And how will people target you and things? So is there a filtering process with your app to make sure that people are who they say they are and things like that? Of course, I know it's technology and it's an app, so things can slide through, but what mechanisms do you guys have?
Yeah. So absolutely. So that was something that was very, very important to me. And you touched on a really good point there. And so as part of the app, as part of the verification, I will say it's definitely more stringent than the typical app out there, because for me, it's more important for me to, be able to vet, all the members of this community. And so, it does require that you have an NPI or a license, or if you don't, there are other methods that are comparable in order to be able to be part of this dating app community. Because there are, unfortunately, like I've encountered, and a lot of my friends in our community have encountered a lot of scammers, a lot of fake profiles out there. And, we honestly, like at the end of the day, like we don't have time for that. Just be, we're busy. We're all busy, whether you're like your community, you're pre-med, you're in medical school. And also, and also just to be able to be part of a community that you're interested in, that is aligned with what your goals are in life. Like our tagline is date like-minded professionals. And this is, a niche dating app is absolutely not certainly for everyone, but I think this is such a huge need, to have this dating app because there's this gap in the dating app world currently, and that I wanted to be able to, fill that gap for our community.
So is this the first foray that you've gone into creating an app? Was it a very difficult process for those who may be interested in looking into, I don't know, creating a health study, like MCAT study app or something like that? Was it a very difficult process?
Oh my goodness. It's been such a huge learning curve for me. I have zero business background. I have zero tech background. So I'm learning as I go. Some days I don't even know what I'm doing still, but it's all about the action, right? It's all about that first step, getting started. And then you figure it out along the way, and you also get help. I certainly have help as well along the way. So as far as, developing an app, really the key is to be able to find the right developer. And that in itself has been a work in progress for me as well. I think I've finally reached a point where, we found a good balance, but that was sort of the reason why, to be honest, it actually took like over 2 years to develop this app. Not that it should not. I just didn't know what I was doing, and I was figuring it out. And there was just a lot of hiccups. And fortunately, a big part of it was also because of COVID too, and how it affected some of the team members as well. So, but yeah, for anyone who's interested in dating app, it's totally doable. How hard it is kind of depends on the kind of app that you want to develop. It's something very simple, how much, interaction you're looking for, and how much, and also like we're talking about what degree of bells and whistles are we talking about, right? So app can be very simple. You can just design something really easy, and then I would say always start there, have an idea and test it out. You have to test it out first because you don't want to be investing, because it is quite a bit of an investment. You don't want to be designing a product that you don't know that is necessarily something that is needed or, out there.
I love that. And it's kind of like translating the scientific method, like looking at it, having a hypothesis that it's something that's needed, and then working through the issues until you get to the results that you want to do. And sometimes, like for those who are doing research, you don't always go straight and narrow right there. So it's definitely something fun that you've used to apply to something that definitely is a need out there.
Yeah, it's fun. It's very different, right? It's very different from our training. Mm-hmm. Absolutely very different, but it doesn't mean that the tools and the skills and the problem solving, and also our mindset that we've, gained throughout our training, is something that can be transferred to really anything actually in life, whatever it is that, you're interested in doing. I'm all about, taking that action step these days. And I strongly encourage it. Certainly that was not me before, but I think being part of communities such as yours and some of the communities that you and I are in, I think has really helped. And so I think I can't emphasize the importance enough of community and how much, being part of these various communities, can provide us the support and can elevate us and help us reach our goals that we desire.
Absolutely. I couldn't agree more. So for the listeners out there, as you know, we have students who are in pre-med, people who are in residency, even above, but we also have pre-meds listening. So I know we have all of these dramas and things out there. And like we mentioned, the dating world isn't as fun as it could be once you hit medicine. It's not all like Grey's Anatomy for the pre-meds out there listening.
Right.
So a lot of my friends talk about it like some of our classmates went to med school and they got their MRS degree along with their DR, like their MD or DO. But what advice do you have for those who are still in the dating field, in healthcare, in terms of how they can balance studying if they're still in school, or if they're working and they have the shift work and things like that? How can they still have that work-life balance with dating and get out there?
Yeah, very, very good question. Certainly is challenging, right? Because you are in the deep of it and, wanting to, advance to that goal. So I would say a number of things come to mind. First of all, I would say mindset is the biggest thing, right? So Henry Ford, I believe, famously said, if you think you can or you can't, you're right.
Mm-hmm.
So just know that. So have the belief that you can, right? And it's all about balance. And so I think it's so easy to get consumed into our studies and our shifts and our rotations, like we've all been there. But it's actually really, really important to be able to, have those relationships, to nurture, maintain those relationships, because it actually will improve your productivity. Mm-hmm. So I do encourage that you all get out there and meet people, and it could just be getting to know somebody. And in the process of getting to know like someone else, you actually get to know yourself a lot better. At the end of the day, to be able to find like your person, it ultimately comes down to knowing yourself and loving yourself. And that will ultimately guide you in the right path of being able to meet your right person. Having boundaries is also really, really important, as we all know. So you also have to be able to gauge, what it is like is important to you, where your boundaries are. Having proper communication, as we all know, being able to properly communicate when we're in this, dating part of our life. Yeah. And at the end of the day, it's all about the can-do attitude and working together as a team. So I think ultimately, I think those are the top things that come to mind right now. And last but not least, we all got to get up from our seat, from our couch, right? There's only so much studying that you can do. And it's at some point, it's no longer effective that, you have to be able to feed your heart and your soul. And at the end of the day, we're humans. We crave human connection and we crave those relationships. As I said earlier, this is such a big part of optimal health. Keep in mind that these are really important years, but don't let them pass by without making sure that you develop and nurture those relationships. Because the biggest investment that you can make in yourself is actually finding your partner will affect your health, your wealth, and even your sanity. Mm-hmm. Think about all the time and the dedication that we put into our career or the pursuit of our career, and that let's not, lose sight of what's truly important, because you can earn all those accolades, and we will. But if you have no one to share it with, then was it worth it? So I think balance is the key. And so get out there and encourage everybody.
Yeah, I couldn't have said it any better. So there are opportunities for everything in life, and you have to make time for what's important to you. So we've talked about how you're revolutionizing the dating scene. So I love to ask this to all of my guests. If there was one thing, if you had a magic wand that you could change about our healthcare system, because we need some changes, what would it be?
Yeah, I think it's pretty similar to what I said earlier. I think that we don't put enough emphasis on community in our education. So the first 2 years of medical school, we had community, right? It's didactic education. It was a lot of fun. Certainly we worked really hard. We had to study a lot. And then you go to the third or fourth year, and you feel very isolated. You're on the wards. And I think at that point, I remember for myself and a lot of my friends is that lack of community, right? From there. And we all go through so much, the ups and downs, and we all encounter a lot of the similar types of feelings and struggles that is not always talked about. And if we had the community to provide the support, and I think that could make a huge difference. And even beyond that, as we move further into our career, I think the aspect of community gets really lost. And I'm actually really happy. And that's certainly one of the silver linings of COVID, to sort of bring back the concept of community. Certainly COVID has really highlighted the fragility of life. And more than ever, we crave the community that we all need to provide support. Because if we can be part of a supportive community, think about all the amazing things, right, that we all can do for our immediate, community, for society at large. So that's why it really has become my passion now to be able to support our community. If I can be part of this process of helping you find your person and providing those connections to a more vetted community of professionals that were interested in dating and perhaps, become life partners or marriage, whatever it is that you desire, then I want to be that process to uplift you and help you find your person so that you can have all the support that you need and we can support one another so that you can achieve all those great things in life and goals that you have.
I love that. Community is so important. So you've shared so many pearls of wisdom with us, and unfortunately, it's time for our session to come to a close. So I just want to give you an opportunity to tell our listeners goodbye, how they can reach out to you, and where they can download the app.
Yeah, well, thank you so much, Erkeda. It's just been so wonderful to have this discussion with you. I'm honored that you invited me to be on a guest, and thank you to our listeners for taking the time to listen. So, yes, if you're single and would like to join our community, you can just go to whitecoatromance.com. We are on 6 different social media channels as well. So you can certainly find us on Facebook and Instagram, LinkedIn, Twitter, TikTok, and YouTube. Come join us. And if you're not single and you have friends and family and colleagues that, would really benefit from this app and you'd like to be a matchmaker, please help us spread the love and help us grow our community. We really appreciate that a lot.
Thank you so much for coming. And that is my life goal, to be a matchmaker and play like Cupid. So I'm definitely going to spread that app around. And all of the listeners out there, if you're not looking, I'm sure you know someone who is. So you spread it around as well.
Yeah, thank you.
Thank you. And for all the listeners out there, if you have any questions, feel free to message us at Med School Coach on Instagram or my personal Instagram, DOCOTORD Graham, Dr. D Graham, and let me know if there are any guests that you want to hear from or any topics that you want us to cover. And we'll be back again next week with another fantastic guest. Have a great day. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.